Hi, today we're going to be talking about amputation and related issues and potentially receiving more benefits for those. So we hope that you'll join us. Hi, and welcome back to Hill and Ponton's VA Disability Blog. I'm Natalia Joffrey, the company COO.
And I'm attorney Ann Linscott.
Hi, Ann.
Hello.
How are you?
I'm good.
Good. So today we're going to be talking about amputation. I don't think we've ever covered this topic before, so I'm glad that we're discussing this today. My first question, because we always talk about the degrees of difficulty when it comes to applying for VA benefits, is it difficult to get VA benefits or a claim one for amputation?
So I'll give you the most stereotypical lawyer answer there is, which is it depends.
Uh-huh.
So when it comes to
Before.
amputations, if we are talking about the amputation resulting from some kind of injury that happened in service, those are going to be pretty cut and dry as far as proving service connection. So if you lost a limb in combat or, had a gunshot wound in combat and had to have surgery to remove a limb, that's going to be pretty clear that it's related to service. And that is, I don't like to use the word easy because I don't think anything with the VA is necessarily easy, but it's going to be more straightforward versus if you are trying to get service connection for an amputation that may be because of a secondary issue or years after service related to something else. So again, it depends.
Yeah. Okay. Can you tell us what some of the available benefits are for vets that have suffered an amputation?
So the major ones are, of course, with the VA disability compensation. You can get different ratings. For example, just because it's easy, you're dominant if you're dominant hand or dominant arm. The ratings vary based on kind of the details of the amputation. So where it's located, things like that. Obviously, you're going to get a higher rating if it's a dominant arm because that has, in the VA's mind, more of an impact on your life. Mm-hmm. So another benefit in the world of disability compensation would be special monthly compensation, which is, again, it's a monetary benefit. For example, if they're at 100%, you can get additional compensation for that. So there's SMC available for, it's called loss of use. So amputation would fall under that.
I just did a video recently with Melanie Franco, your colleague, regarding loss of use of hands. So that would come into play here, obviously.
Right, and loss of use is based on they're kind of comparing, is the use that's left in the limb equal to what it would be if it were amputated.
And I was also talking to Allison Reddick, your other colleague, and she was also talking about aid in attendance and special monthly compensation benefits. So I guess this could fall under that as well, right?
Definitely. And then there's other things, automobile, adaptive equipment, different grants to have work done on your house. So things that aren't necessarily, those aren't benefits that we typically assist with getting, but it is things through the VA in addition to just your typical, monthly payment. The VA provides prosthetics, different things like that. So that's all through the VA healthcare side of things, but there's definitely more benefits available than just monetary benefits.
Okay. I know that obviously, if an amputation occurred while in service, that is kind of where our mind goes when we're talking about service-connected benefits and amputations. But are there amputations that could have occurred outside of combat that could also qualify you for benefits?
Definitely. So if we're talking about something that happened in service, regardless of if it was combat or veteran on a mission, if it happened in service and it wasn't because of willful misconduct, I'll get into an example, then it's related to service. It doesn't have to be military, job related. So the example that, if you're driving in a car, you have a car accident, you're active duty, you're on service. If that car accident was because you had been drinking, and then as a result of the accident, there's an amputation, that's probably not going to get service connected. The VA will say
Right.
the drinking was willful misconduct and that prevents service connection. But if that's not an issue, and the car accident, just because it wasn't, you know, related to going out on a mission or anything,
Mhm.
then yes, that would be related to service.
Okay. What if, so I'm going to give you this longer example. I often correlate diabetes, severe diabetes, uncontrolled diabetes, that can result in, many times having a foot or toes amputated, things like that. What if the diabetes wasn't in existence while you were in service? But as we know, diabetes is one of the presumptive conditions with Agent Orange, right?
Mm-hmm.
So what if you're now 70 years old, have diabetes, and you have a foot amputated as a result of your diabetes, which you contracted or is service connected?
Yes, that would be a perfect example of secondary service connection. So the service connected the first condition, the diabetes, that's related to service, and it caused the amputation, a complication from the diabetes, which is, like you said, very common. Then you would want to file a claim for the amputation for any of the residual problems from that and claim it as secondary to the diabetes.
Okay. And then we've heard of other conditions like spinal cord injuries, cold weather injuries. You don't think about that, but if you're stationed out in Antarctica or somewhere, or even, gosh, I've heard that the hills of Afghanistan get extremely cold. So if you suffer some kind of frostbite or something like that, I would assume that you could also qualify for benefits.
Yes, a common thing that causing amputation or that leading up to the amputation is a problem with the blood flow, which cold weather injuries, the diabetes, nerve issues, that's where a lot of conditions related to that or that cause some kind of problem with blood flow are conditions that you might see ultimately leading to an amputation of something.
Okay. And one that maybe people wouldn't think of just because it's not necessarily combat related or service related in terms of you being out in service, but bone cancer, right? Because lots of times, if you had bone cancer while you were in service, could that potentially qualify you?
Definitely. So similar to the diabetes, if you have bone cancer and whether or not it started in service, if it's because of some exposure in service and years later you develop the cancer, and that's going to be one obviously a little more complex to prove. You're going to need in all of these cases probably some kind of medical evidence explaining how the underlying condition that caused the need for the amputation is related to service. But yes, bone cancer is one where, like you said, that's not something that you think of often, but
Mhm.
if that's the cause of an amputation and some aspect of your service is what caused the bone cancer, then again, you're going to be able to claim the amputation as secondary.
And speaking of secondary, unfortunately, lots of times people suffer secondary side effects or issues as a result of an amputation. And I'm assuming that you could potentially get benefits for those as well. So can you
Definitely.
talk a little bit about those secondary conditions or complications?
So any kind of complication that comes from an amputation, it's along the same lines of before. If it's all stemming from something that's related to service, as long as you can prove that chain, that flow, then you should get benefits for, think of it as almost a symptom of the amputation. A lot of veterans with amputations might find that they have to be temporarily hospitalized
Mhm.
for some kind of care related to the amputation. And if that's the case, definitely pay attention to how long your hospitalization is for. Anything that's 21 days or over, you should be getting temporary 100% if you don't already have 100%
Mhm.
rating for that. So that would be something that, unfortunately, they have that number, the 21 days on there. But that's common as far as, if it's causing problems that require hospitalization, you don't want to forget about that. You'll hear it called convalescence claims.
Okay, okay. I'm going to give some of those conditions just so that people can relate to them and maybe it'll trigger a correlation. But infection, angina, chest pain, heart attack, stroke, pressure sores, wound infections. We talked about that. We see that a lot with diabetes, deep vein thrombosis, depression, and of course, other mental health conditions. So here's the follow-up question. Can you claim any of these conditions as a secondary condition to your amputation and receive VA benefits for those?
Definitely. So it depends on the diagnosis, and it may be, depending on the diagnosis, it may be more difficult to make sure the rating is correct if it's something that the VA recognizes. That doesn't mean it's impossible. It just adds to the level of complexity. But mental health is a really straightforward example. So if a veteran has diabetes, we'll go with your example from earlier, has diabetes, it's from Agent Orange exposure. That diabetes is presumptively service-connected, leads to problems that an amputation has had. Not only is just the physical troubles that come with that hard mentally, but just the change in life. We see mental health claims are very common with any kind of physical problem. You're changing your life, things that you used to be able to do and you can't do anymore, things you wish you could do. That has a big impact on someone's mental health. And so that kind of, like I said earlier, chain of events or chain of conditions, if it's all linked together, you can get VA benefits for, in that example, depression.
Okay. Are there other available benefits other than VA benefits for amputees?
So like I mentioned earlier, some of the VA will provide prosthetics in some situations. There's different housing adaptive grants. The VA will provide money to help outfit a house, an already existing house, to make it easier for a veteran and an amputee to live in, or if they're having to purchase a new house. So there's a range of different benefits like that. With any of those, my recommendation as far as getting more information would be reaching out to a patient advocate, because all of those are very related through the healthcare side of things, especially if you're talking about some kind of prosthetic or something like that. That's going to be something, even though it's all under the VA, if it has to do with the healthcare side of things, reach out to a patient advocate.
Okay, great. Well, this was super helpful information, Ann. Thank you so much.
No problem. Thank you.
Thank you also for joining us. If you have any questions or concerns, please visit our website or call our office.